My name is Jessica Pasley, and I work in communications. I found out about the trial because we were in the ICU at Monroe Carroll Junior Children's Hospital at Vanderbilt with our daughter. And we were in a very bad situation with her. She was COVID positive, as we all were. And she wasn't doing well at all. And one of the physicians asked us if we would be willing to participate in a trial for COVID with plasma. I was like, sure, if this is something that can potentially help her. I was kind of reaching for really anything that would assist her in getting better and basically to survive. She was dying. She was not doing well. They had put in DNR orders, and there was just a high chance that she wasn't going to survive. And we had faced those challenges before because she's got a lot of critical and chronic issues, but this was different. Things were rocky. And when they mentioned that there was something available that could help her, there was no guarantee, obviously, but the fact that there was something that was available that could give us a little bit of hope, yeah, you grasp onto those, right? I mean, you kind of say, sure, whatever we can do. And so we did. When the research assistants came over to talk to us about it, I didn't have a whole lot of questions. Gigi was so sick, she was a little anxious about it because she heard the word blood products and side effects. And with her feeling so badly, she didn't want things to get worse, I guess. And I had to explain to her that the side effects were the same thing as if she received blood products when she had cancer. She received so many blood products then. I was like, Gigi, there's no difference. The side effects are the same. And believe you me, they screen the blood products just like they did when you received them during your treatments. So once we told her that, and that there were no real downsides to it, even if she received the placebo or the plasma, that it was not just going to help her, that the results in general were going to help so many other people. And that's another reason. We had been faced with that before in her other illnesses, that when we did things, we sometimes knew that what we were doing was not going to initially help our child, but there was the potential that the findings could help somebody else. Specifically for this, though, we were desperate for something that was going to save our child. We were really anxious. I mean, we were in a very small room, and we were doing a lot of pacing because, you get this initial surge, I guess you could say, because you're like, oh my gosh, there's something that can help, and then you start thinking and knowing, wait, okay, we don't know whether she's really getting it or if this is the placebo, but you still feel a little encouraged, right? And when you see that your team is feeling like, okay, there's something out there that we can try, it gives you a little bit of hope. So, we've always participated in research on different levels, whether it's saying, yes, you can have the extra vial of blood when you draw this or whatever. We've enrolled in a few COVID studies, all because we know that if we provide some samples, whether it's a nasal swab or blood, or provide information, whatever it is, we know that it's going towards helping figure this out. There's millions of people that want this figured out. There's no harm in doing it. You're giving something that could potentially save the life of someone else. There's no harm in enrolling as a person who's COVID positive, because there's a 50-50 chance that this could help. What are the side effects? Are there any potential reasons why we shouldn't? Could this have any long-lasting effects? Could there be any potential reason why she could receive a blood product and it be tainted? And we know that over the past 20 years, blood products are tested and they're screened. But definitely for yourself, for your own family, yeah, you ask every question possible. I mean, you need to have all the answers. So for 5 weeks, we've been in the hospital. It's been stressful. We've had some ups and downs. COVID definitely did a number on her heart and lungs. We're hoping that since she has seen some incredible improvement, we're in the recovery phase, and that we'll be able to go home in the next couple of days. It wrecked our world. I mean, it did. It wrecked our world. I was diagnosed first, and my husband went to be tested when my test results were returned. Initially, he was negative, and then he started showing symptoms. We all had different symptoms and levels of intensity. So I would say that I was the most mild in the house. Very nauseous, headache, lethargic. My husband had a cough he's slowly getting over that cough just now. He had absolutely no energy and a very high fever. And then Gigi, who already had chronic illnesses, her symptoms were hard to detect because she was already ill, and we didn't know whether it was because of that or if it was COVID, and no one's ever going to know that. But once it hit her a few days after she was in the hospital, it literally went for her lungs and her heart, and it did severe damage. And she was obviously on ventilator. She was not intubated, which is what we were trying to avoid. Intubation definitely could have led to an outcome that we would not have wanted. But that was their goal, was to avoid intubation for her. It's not something to mess with. Take it very seriously. I mean, I know I just giggled just then, but it's more out of nervousness of just people have got to take it very seriously and do what you can to help each other. It's wreaking havoc on our country. It really is. And it's ruining families. It's taking away family members that were otherwise healthy even. And my child wasn't healthy. I mean, she wasn't healthy. And so it was even more important to keep her protected. And we couldn't even protect her. And she was at home, quarantined since March. Without research, you don't advance. I mean, you need that in order to see what the best treatments are, what the possibilities are for vaccines or treatment options, whether it's a cancer treatment or for CF, research is there because we need to find the best option for people to survive an illness.